as well. Dr. Petzel, would you like to respond to Mr. Williamson and his presentation regarding their report?
Thank you, Mr. Chairman. I would. We appreciate both the GAO and the IG inspecting our reusable medical equipment processes as well as the other things that they do, because as I said in my oral testimony earlier, we do learn, and we have concurred in the recommendations that the GAO specifically made. I want to point out a couple of things. Number one is that we do now have a standardized database that covers the majority, the vast majority, in fact, of the processes, the standard operating procedures for processing reusable medical equipment. And that means that we do have, across the country, standardized operating procedures for cleaning. In those areas where the commercial database does not cover, we've developed those ourselves. And contrary to what Mr. Williamson said, we do not tolerate people writing their own procedures. We have a standard for cleaning whatever that piece of equipment is across the country. It may not have been completely in place at the time they did their inspection, but it is now, and it is our practice around the country.
If I could, on number one, you said in place for most of, but the implication is not all.
Well, what I said was that the commercial database that we bought does not cover absolutely everything. And we have developed, or we have in place, processes for those things not covered, which are relatively few, not covered by this database that we
Give me an
purchased.
example of what wouldn't be covered. Can you?
There might be some small surgical instruments.
Does that mean you wrote them, or?
That means the manufacturer has them, they're not in the database, and we use the manufacturer's information.
So you do